This conference will now be recorded.
Welcome to the Bladen County Board of Commissioners meeting Monday, August the 5th. Reverend Bruce Miller will do the invocation and Dr. Phil Ungo will lead us in the pledge of allegiance. Please stand. Bruce.
Gracious Heavenly Father, I thank you for the privilege of being able to be here and pray for these hard workers and save people who have strong commitment or they wouldn't be doing this. And I pray for them, Lord, and I pray that your Spirit would guide them, help them make decisions. I pray for them, Lord, and for this meeting. I know that they have things come from all directions, and just pray you give them wisdom. And I pray, Lord, for all those that are here, just to take a part, maybe to listen, maybe they have something to share. But Father, may we all remember we're here seeking to do what's best for this county. Pray, God, you help us, give us guidance to. I ask your blessings upon each one of these 8 and for their families. In Jesus' name, amen.
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 Let us pray. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Now, before we approve the consent items, I need to amend it, pending board approval, to include item 4A to consider adopting a proclamation declaring a state of emergency. And Governor Cooper has just declared the state of emergency just a little bit while ago. We want to make sure we got ours in, so we'll have to try to get something later on this week.
Okay.
So, someone,
I'll motion that we that amendment be done.
and you approve the
And approve the consent items as well.
motion by Mr. Brooks, second by Dr. Freeman. Go into any discussion. All in favor, say aye.
Aye.
All opposed? Thank you. Individual delegation wish to address the commissioners. Matters of interest to commissioners.
I got one too that's somewhat of confirmation of what you just spoke about, Cooper. I got a call from the philanthropists that provide assistance on hurricane relief, and they said that they would be, they notified me if we needed something to give them a call. They could bring in medical supplies, food supplies, but we need if you can use the warehouse.
Well, you need to get with, Terry Duncan and Vicki Smith and Joy Coleman and David Howe, I would say. Because there's a meeting tomorrow at 2:00 to do all that, and they'll need that information. And you're welcome to, any commissioners welcome to come tomorrow at 2:00.
Where's it gonna be at?
Right here,
It'll be right here
right here,
at 2:00.
2:00. Any other matters of interest, commissioners?
Mr. Chairman, I received a question, want to know what Bladen nonprofit responds to natural disasters in Bladen County. I don't know. And what
You got Red Cross right down there at Dreamworks. I don't know. I don't know if there's anyone else right now,
Okay.
nonprofit.
Also, one other thing, I was asked to report to the commissioners that a sign was needed on Mercer Mill Road saying the landfill with an arrow on it. A lot of people are missing that turnoff there. So they asked, could we put up a sign with an arrow on it saying landfill?
Give months a little bit.
And then one other thing, I was asked for what is the funding amount for revitalization grants? Does anyone know what they're talking about?
Something to the organization is doing. What's it about? Home, business?
I think it was business.
And Chuck can answer that.
I give it to Chuck. All right, thank you, sir.
Anyone else? Opioid settlement funding, Ms. Isabella, want to make that presentation. And the first one is, I'll let you start them with you do what you need to do.
It's a PDF attached to it.
So my hard copy.
Okay, so I'm Isabella Faison. I'm health educator too at the Bladen County Health Department. And I'm going to briefly go over a little bit about the Bladen County opioid settlement funds and the plans. And this is a little bit different than my PowerPoint, so, oh Lord. Let's not do that. Okay. Let's see. Okay, first I'll just kind of go over a little bit of the data points, comparing North Carolina to Bladen County. And I really do apologize because my PowerPoint had this set up a lot better for you to see it. I'm not sure if you can you zoom in maybe?
You should be able to.
You can.
Okay, y'all can see on that. Okay, thank you. Perfect. Okay, thank you. That works out. So for the first table on the top, 9 out of the 11 types of drugs have a higher intent of poisoning death rate in Bladen County compared to the North Carolina rate. And on the left, the overdose hospitalization rate. Okay. It's right here.
Okay.
I'm sorry. Okay. Yes. Here we go. Okay. So I'm going to talk about a little bit of the data first, so we can kind of go over the need for this committee. So again, for the first table at the very top, it talks about the intent for the poisoning death rate. And so 9 out of those 11 types of drugs have a higher intent of poisoning death rate in Bladen County compared to the North Carolina rate. And then on the left side, our overdose hospitalization rate is 137 compared to 99.7, which is a 38 rate difference. And then for Bladen County, our unintentional poisoning death rates are 58.2 compared to 36.7 in North Carolina. And then on the next page.
These are wrong numbers? Are they wrong numbers?
So it's a rate for 100,000. Yes.
Okay.
So on the next page, it discusses the chronic alcohol attributable deaths. And alcohol is a substance that's easily overlooked in this topic. So as you can see in this data set, Bladen County has a higher death rate for 9 out of the 11 years compared to the state.
That's great.
And on the next page, I'm going to discuss a little bit about the different options. So we're transitioning from option A to option B. The opioid settlement monies are moving from option A to option B, and we chose A initially. And so option A was very limited. It has a short list of strategies that we can utilize, and it doesn't really allow the county to tailor it to the community. So we're moving to option B, which involves the collaborative strategic planning process, and it has a variety of options to choose. And it also requires the opioid steering committee, which the commissioners appointed, so that we could have best fit strategies for the community. And we were also granted permission by the Attorney General for this transition. So the next page is this diagram. It's the recovery-oriented system of care for substance use in the community. And this is just the diagram that we utilize to generate strategic plans and goals in the committee. And then the next one talks about our strategies that we use. So to date, Bladen County has funded 2 strategies in option A, including the Healing Place of New Hanover County, which offers detox, short and long-term rehabilitation and transportation to and from Bladen County to the Healing Place. And then we have also funded support for strategic planning through ACT Consultants to find more grants and resources available. And for option B, we plan on funding the evidence-based prevention program in schools called Life Skills. And Life Skills is not just about saying no to drugs. It's about making the right choice, and that each choice has a consequence. We also will provide resources to opioid programs, increase availability of naloxone for individuals that treat overdoses, and support EMS by initiating a peer support specialist and other recovery services. On the next page, I'll discuss how we are planning on measuring our outcomes. And so we will hold a quarterly meeting to address progress of plans, evaluate data, and the use of the money. We will also review the number of contacts or referrals for substance use resources. We'll measure the number of naloxone kits distributed and review our goals for the strategic plan to make sure those are being met. And then with Life Skills, we will analyze the completion number as well as the short-term suspension number. And then the last page is a visual of the budget. And I can So this is just a visual of the budget for right now, and we will review the budget later on for approval at a later date.
Have any questions?
Mr. Bullock?
You might have said this, but which page has a positive impact on lowering the death rate in Bladen County?
So these data points were just showing that we need this committee and that we need strategies in place to improve these deaths. So this first, so this one talks about the deaths for medications. And then on the back of that talks about the alcohol deaths.
I was just concerned about if we had anything in place to counteract the death. That's okay. Thank you.
Yeah, your proposed budget for strategies is what's
Yes.
going to prevent it.
Yes. So that's what our strategies for working.
All right.
Mr. Cogdell?
Charles, I know y'all guys did the open North Southern group. I can ask her, what is the total allocation that's coming to the county for the open North? You asked for $432,000. Is there a set amount that's coming from the courts and Bladen County that's coming?
We'll get it for you. There's 3 or 4 pots of money coming. There's a Kroger settlement, a Walmart settlement. There's all kind of settlements coming. So we'll get you that number. I don't know.
The total.
It's all in this packet here. This is a long
When
detailed
did you
packet.
have this?
No, the one on the screen.
You have the total amount?
Yes, they have a lot more information about that. This was just a little brief overview.
Now, the reason I asked the question, I know that I heard them say they're gonna give the same type of settlement based on the past one, when they gave the second set of money. When they first gave the first open North settlement, they came in. They were saying something about they were gonna come back with
It's all based on the first settlement.
the very first settlement, then you're gonna come back with the same amount, the same type of ratio, because the amount is kind of how much each county gets.
We'll get that number to Mr. Cameron.
It'd be in order to approve A through D. We're obviously, none of us are deeply versed on each of these individually. It'd be in order to approve A, I make a motion to do that. So,
I understand that we're sure the funding gonna be there to do all this, that's why I asked this.
Yeah, the money's here.
So the money is here, that's what I'm asking for, make a motion, let's be up there. If you want to make a motion, I second.
The money that, from the original settlement, if I'm not speaking out, there'll be a little money. In the past years, there's money left over, and that's our fund balance from opioid money. We're gonna use some of that money to subsidize this budget. That will be approved at a later.
Okay.
So there's a motion to approve A, B, C, D,
I second it.
and Mr. Rodden's already seconded.
Okay, he seconded.
One thing that we are doing this year, we never have done before, is putting $90,000 to Southeast Crossroads. And that'd be Bladen County kids that does Southeast Crossroads, and there's a invoice and everything they got to fill out, and there's a contract in there that they got to fill out that we're gonna sign before we start and all this stuff. So that's one thing that we're doing different that we haven't done before. And then I think we're waiting on, once we do this, we're waiting on the Attorney General to review it and let us know we can go to option B, and then that's when the rest of it comes for approval for the commission.
How about your healing place? How much we give now?
It's 100, it's 120, 100?
6 beds. I mean, 6 beds. And then we've been using them, anybody know how much they've been there?
Is that,
50%.
that an annual rate of this a one-time cost?
Only use if there's somebody in the bed.
$90 a day. Is it $90 a day? Where we got 6 beds there that we can fill. Okay, motion by Mr. Campbell, second by Mr. Esther, ABCD. Any discussion on those? All in favor, say aye. Aye. All opposed? Thank you, Ms. Isabella. And this, Rich, that's what I was saying, we'll review the draft that goes to Attorney General. Kim McCary. General Service Department. Director.
Good evening.
Department addition.
Yes. You have before you tonight a request for board action to approve moving forward with the renovation project for the health department. After 3 years or more of work in designing and redesigning, we finally were able to go to bid, and we had to go to bid twice to get enough bidders. But we opened bids on June 27th. Cornerstone Construction was the low bid with a bid of $820,000. High bid in this particular job was $1.2 million. It's a big spread amongst 4 bidders. But we feel like that Cornerstone has a very competitive bid here. Our architect, Mr. Brandon Love, has recommended, he has done his due diligence on this contractor, has checked his license, has checked references, and given us a recommendation to award contract. So tonight, what we're asking you to do is authorize staff and Mr. Peterson to award contract to Cornerstone Construction, and we'll develop the documents that make that contract for them to sign.
By Mr. Britt, second by Mr. Gillespie. Any discussion?
One thing, this.
Ms. Dardo, here I'm going.
I have a question. Where are they located? Are they local?
Was this? They're in Lumberton.
In Lumberton?
Cornerstone Construction's Lumberton.
Pretty good. They're close enough.
Yes.
I know we've talked about this project over a while, long period of time.
Mhm.
Did we appropriate a specific amount of money?
$820,000.
That's what we appropriate, right, the $820,000.
Any work changes will come from the health department, so.
Change orders
come from the health department. Health department fund balance.
Long they know that. They only have $1 left, not a penny left.
Any other questions?
I got a question for him, and then not on this subject though.
You ain't got a question for me, hold on. Any, all in favor, say aye. Aye. All opposed? I'll give you a few minutes.
Okay.
I'll give you a minute.
Okay.
We'll be right there. Hold on, Kip. Thank you, Kip.
Yes, sir.
Health Department, Terry Duncan, review Bladen County health ranking.
So there's 100 counties in North Carolina. If one is the most healthy county, in North Carolina, and 100 is the least healthy county in North Carolina. Where does Bladen County rank?
One.
We want 97.
Where is it?
We're in number 100.
Number 100.
So 5 years ago, we were 95. Last year, we were 85. And my goal was to get out of the lower percentile. However, nationally, they have changed the health rankings, and we are no longer assigned a number. We are assigned a number on a grid. Well, not a grid, but assigned a little bubble on a grid. And we show we still are in the lower percentile. Traditionally, Columbus, Bladen, and Robinson used to vie for who was going to be. Robinson traditionally has been 100. Bladen and Columbus vied for who was going to be 98 and 99. So now Columbus has moved up to 95, or was last year, and we were 85. If you hold the graph up, you can see that we're a little bit ahead of them, but we're still not out of that lower percentile. So we still rank lower than the national and state average on health outcomes and health factors. And health outcomes are such things as length of life and quality of life. The health factors are things that we can do things about that will help our health outcomes, such as the number of people that smoke, or obesity, and people that have access to exercise. So just wanted to give you an update on the current health ranking. And you could Google, you have the health ranking document that there's a lot of information that you could Google it forever. I have compared Columbus, Bladen, and Robeson County, as I told you already, and we're proud of where we are, but there's so much work that needs to be done, and we have done it together. The changes that we have made, not one agency has done it, not one person has done it. It has been the work of true community partners.
And not just, the entire county. It's not one place, one key possible.
Any questions?
Next item is consider accepting Bladen County State of the County Health SNGCH report.
So we'll start a little bit with the 2021 Bladen County Community Health Assessment. We did perform a community health assessment in 2021 with such partners as the hospital, the school, the library, of course, the county, social services, basically the members of the Healthy Bladen Collaborative. In that process, we did a survey, and we had over 400 respondents. And with this most recent one, I'll get to that a little bit too. We then looked at secondary data from state databases, such as what's our length of life and quality of life, and how many people smoke, how many people drink and drive here in the county. But we looked at primary and secondary data. The next part was to look at our health priorities. We did that through a prioritization process where the healthy community partners identified factors that impacted our health, and they were affordable health care, safe environment, access to available resources, including transportation, sustainable wages and job opportunities, family support. And from that, the Bladen Healthy Collaborative identified 5 health priorities: diet, exercise, and nutrition, substance abuse, mental health, diabetes, and access to health services. To further solidify the process, we identified 3 top priorities, and that's what we have been working on for the last 3 years. And those were diet, exercise, and nutrition. We know that through diet and exercise and nutrition, if we can make healthier habits there and healthier behaviors, we can impact heart disease, cancer, those comorbidities and mortalities. The second was substance abuse, and the third was mental health. We learned that the top 5 causes of death in our county were heart disease, cancer, chronic respiratory disease, diabetes, and surprisingly, Alzheimer's was 5th. So in the last 3 years, we've been working with the Healthy Collaborative to address those 3 areas. When we look at the state of the county and where we are today, we're proud to report that the state has issued us letters for our 2022 and 2023 State of the County Report. Also, our 2022 Bladen Community Health Improvement Plan was approved. When we think about the Bladen County Health Improvement Plan, we identify through the areas of diet, exercise, and wellness that we work through the worksite wellness program that you have heard about and are supporting with your dollars. We also are working with the Healthy Bladen Collaborative for Walk to the Cross and Walk to Bethlehem, and actually partnered with Healthy Robinson to do that our first time. We also did the Healthy Holiday Challenge. We have reported on that to you in the past. That is or was a state, national, and international program. This was the last year, December. We were no longer able to do that. We showed some pretty significant participation in that from all across the county. We also looked at accessible, safe, and physically accessible exercise opportunities, and we're thankful to Trillium Resources for that park out at the county park and what they have done. You rarely go by there that you don't see children playing in that playground. In the work that we've done with substance abuse, we have worked with the health department and with BSS to screen better individuals that are coming using an evidence-based screening program, the screening, brief intervention, and referral, and we're able to directly refer clients that are in need of behavioral or mental health to a provider. We've also worked with the Bladen County Substance Misuse Task Force, and you know we got that HRSA grant, that there's been some remarkable work done there. We just closed today our final monthly call with the HRSA representatives, and I'm proud to report that we got the no-cost extension, and we'll be able to do some further work there with that substance misuse, particularly putting peer support specialist in the emergency department. We're working with the hospital to do that, and that's proven to be a great program. For mental health, a couple of years ago, people would say, where can you get mental health resources in Bladen County? Where are they? There are none. And people still say that. But we have so much more than what we used to. We can remember that now we have the mobile clinics, the Coastal Horizon vans, as well as the RHA vans that literally cover every part of our county at least one day of the week. That's something we've never had before. We have a brick and mortar building with RHA in Bladenboro, and we have a brick and mortar building here with, Sunbridge is not the name, but that's pretty close, the one that's right down here on Main Street. So a lot of work has been done there. We are continuing to look at the morbidity and mortality in our county, and there have been no significant changes since that community health assessment, except the COVID. But as far as what was identified as heart disease, cancer, and breast cancer, heart disease, diabetes, there are no emerging issues as of right now. When we did this report a few years ago, nobody could have imagined COVID. And we're continuing to look for new initiatives in the future. As you all know, we just completed our last community health assessment survey. Again, we had over 400 surveys this year from different parts of the county. We have a meeting just in a couple of weeks to begin that prioritization process. And as the Board of Health and the county commissioners, I encourage you to be active participants at, and certainly you'll get that opportunity. I'm expecting some of the same priorities to be there, substance misuse, while we have done a lot of work and a lot of important work, and we have saved lives, there's still a lot more work to be done. So, any questions about the state of the county report?
Ronnie, you gave the top 5 death causes for the county. Is that pretty much in line with the state?
Pretty much.
The text, I think, has been more here on the southern end, like Robinson, Bladen, and Columbus. The cancer numbers seem to be higher than Chapel Hill and other places for some reason. And I don't know if it's environmental. I don't know, but it's the numbers. My question to you, does the men and women, do they have that grant for delivering fruits and vegetables? Or any of that food come to our seniors and places, a lot of it? Have we found that to be helpful? I mean, or do we need more? How do they get it? How do they get access to it?
I think what you might be speaking to is the Healthy Opportunities Project. We're one of the 3 regions in the state that is part of that Healthy Opportunities. I can bring you the Bladen data on that, but they say they have helped, they can show the graph, over 100,000 different opportunities in Bladen County. I think that's the number, but I've got those numbers if you'd like to. But transportation, food are available.
This is more of not so much question of the state union, but it's an acceptance of something that I want to make sure that the commission do with her trying to make this a healthy county. I appreciated Ms. Duncan and her staff for going to the Cobb Street community and involving senior citizens to make them healthy and open that clinic back up and providing those senior citizens down there with food. I'd like to thank you and your staff. Thank you. That part of the county. Yep.
I think they had 21 scheduled today down there.
Anyone else? So, Life Bridge is a storefront, it appears, even though they're supposed to be a mental health provider, they're a storefront. And there is, Coastal does have an office in here. Is it track TRAQ? TRAC. Coastal has an office in, they're gonna start paying rent.
Let me ask you, how about
Yeah, this building.
children have access, or the school has access to children?
The school has access to mental health programs, and through Trillium and the Artworks program, there's an art program through JCPC.
Yeah.
We help fund that.
Right. But I guess my question is, they have a lot of issues, or I'm just looking to their board, some issues. Mr. Owens, my husband's one of them, one of the advocates trying to get some help to those kids in school. So, and my comment to them is that instead of trying to get some other new programs coming into the county, why is it children can't go into school? Because they really need services.
So, Doc, I'll give you a phone number.
Would you do? Okay.
Sure.
Can I get it? Thank you.
Give you
Okay, thank you.
Get your phone.
Yes, you did.
Any other thing? Did you do B and C or just B?
I did B and C.
Okay, so I need a motion.
Need a motion for
Approve
B.
B. Second. Mr. Cameron, second, Mr. Cogdell, any discussion? By the way, where is this report?
Where is the report?
You don't have a paper copy?
It's,
I know.
All in favor, say aye.
I was looking at it.
it's a lengthy report.
Thank you. Thank you, Terry.
It's a lot of information. Thank you.
Soil and Water, Mr. Dean Morris.
Good evening. We have the opportunity to receive some funding for some stream debris removal through the Division of Soil and Water STRAP program. That's the Stream Bank Rehabilitation Assistance Program, and that's what that is. It's not activated after an emergency. It's a proactive approach. And they offered us $131,622. I was hoping for more, but this is what we have at this time. So I would need your decision if you want to accept.
Motion to approve. Second. Motion by Mr. Brooks, second by All in favor, say aye. Aye. All opposed? Thank you, Mr. Dean.
And I ask a question before you part.
Is it about this?
It's in reference to drainage, I guess, storm drain. I knew with all this rain coming in, I already got a call from some people on that 41 down there, 41, what you call it, down there, 14. 14. I got some calls today about the water screaming and that water building up at their house.
Right.
And they were asking when are we gonna be able to get something to do with that. I just seen you had to do.
Well, one of those, Spring Branch is targeted for, stream debris removal with this program. So we'll be able to do something, not like tomorrow. Definitely.
Okay, but you'll be working on that corridor down there.
Yes, that is one that's targeted to be clean. Yes.
Sure about it today.
Did the other, I mean, someone went there
Yes.
and assessed it, right? But their house is already flooded a couple of times.
Right.
Right? What other program, what else do they need other than just cleaning the streets? Because there's something else that's going on there.
Right, well, their house is lower than the highway, and it's lower than the highway ditch. And that's where the highway ditch is draining through their yard, and it goes right by their house. And it's difficult to solve that problem.
Yeah. Can't you handle water?
It really is. Now, the water's always gone that way, but they closed in a carport, and there's no foundation to that, and it's a slab, and water runs through and comes on it because it will feel flood. There's not a fix for that.
No. But I think it's going again, if anything else, they need to raise it.
Yeah, they really do.
Okay. Thank you. So, Vice Board, Hammond, motion to table by
No,
Kim?
no, I've got
Oh, you
two,
did?
yeah.
Okay,
been working on it. So, there are two that have actually passed away. Carl Whitted has passed away, John Graham's passed away. So I'd like to replace Carl Whitted with Randy Jones, and John Graham replace him with Mr. Darren Wheelis. They both agreed to serve.
All right, motion by Mr. Cameron, second by Mr. Britt. Any discussion? All in favor, say aye.
Aye.
All opposed? Lamar Planning Board. Motion to table. Second by Mr. Hester. Any discussion? All in favor, say aye.
Aye.
We need to table juvenile crime prevention one more time.
Motion to table.
Second. Motion by Mr. Bullock, second by Mr. Cogdell. Any discussion? All in favor, say aye.
Aye.
So keep Blaine beautiful. We need to table. We really need, we might have to have some conversation about this committee. Motion to table. Second by Mr. Bullock. Any discussion? All in favor, say aye.
Aye.
So, Kelly, fire district,
Charles W. Bullet Brooks.
Charles Russ said he would serve. That's okay with y'all.
Charles Big Woods.
Right.
Charles.
Right.
Bullet's coming off.
Right.
Charles Russ has a station there, so he stays informed.
Okay. Second. Motion by Mr. Britt, second by Mr. Hester. Any discussion? All in favor, say aye.
Aye.
Personnel Advisory Board.
Motion to table.
Second. Linda Gillespie has agreed to serve. If that's okay with the board.
I make a motion. Withdraw my second.
Make a motion for Linda.
motion for Linda.
Second.
Second, Mr. Cameron. Any discussion? All in favor, say aye.
I have a question though.
She's making me like this one.
Who?
Let's
Oh, wait a minute.
It's very fast. So there's a couple of advisory boards and the ones we tabled tonight for August 19th, calendar review. Blood drive tomorrow at Hickory Grove from 12 p.m. to 5 p.m. and a blood drive at, Lake Church from 1 to 6. The NCAA annual conference at Forsyth County, Thursday, Friday, Saturday. And Saturday back to school at Bladen Community College from 8 to 12. The 12th is the Human Service meeting. 13th is Substance Misuse Task Force meeting. Blood drive at Cape Fear Valley on the 16th from 12 to 3. And there's a flyer in here about the Cape Fear Lodge back to school supply drive. 17th from 12 until 19th, Commissioners meet. Bladen County Schools open the 22nd. And there's a flyer about child support awareness walk. And I'm hoping that we're gonna do something, we'll talk about this at the board task meeting next week. It's to do an overdose awareness day on the 31st. That's National Overdose Day on the 31st. But we ain't planning that yet. We're hoping to do that. September is county offices closed for Labor Day. Tuesday prayer service 8 o'clock. Commissioner meeting at night. Saturday, you got the Mercy House Walk at Bladenburg, and they're trying to raise funds to help support that Mercy House. And I think they're doing very, very well, is what I understand. A lot of people are behind them. Health and Human Service meets tonight, 5 o'clock. Substance Misuse Task Force meets at 10, on the 10th at 2 o'clock. Prince Holiday Community Celebration, locking down number 2 is from 11 to 7 on the 14th. 14th, 15th, Saturday and Sunday. And then the Bladen County Board of Commissioners meets 16th, and Harmony Hall Fall Reunion is the 28th and 29th. Anything else? Individual delegation wish to address the board? Item what?
On calendar review.
Oh, yeah. See, item A is, I'm sorry, thank you, Marie. Consider scheduling a special meeting to receive a corporate extension annual report to the people. And that's at the extension office, right? And she has is it like 4 o'clock, 5 o'clock? 4:30?
That's what we've been having all the time.
Yeah.
We're before the board meeting.
You gonna do it for the board meeting?
Let's do it before the board meeting like we always do.
Okay. Motion by Mr. Cogdell, second by Dr. Freeman going. Any discussion? What was the name? Next board meeting. Okay. About 4 board meetings. It's 16. Is that right?
I thought you were saying. 16. Not 16.
What day is that, 21st?
21st or what?
Yeah.
October.
Oh,
I was thinking straight.
so that's on in October.
This is October.
Yeah.
Oh, October.
Put it on the calendar. Don't let us forget.
We always do it right before the board meeting.
Right.
And 4:30, is that what you said?
Yeah, that's right.
16, don't get a motion approved. All in favor, say aye. Opposed?
Didn't prove we didn't know what we approved.
Yeah.
A politician.
I'll rub it off on you. Individual delegation wish to address commission. Matters of interest, Commissioner, Mr. Cogdell, Mr. Bullock, you asked Mr.
Yeah, I had a question, would it be very costly to pave the, landfill out there off of Mr. Mill Road and get that paved where the public comes in at, to dump the trash? That'd be very costly to do that?
Probably would. Why does last dollar not cheap?
Cause I'm getting some questions in about, well, why is the small one's paved and this big one's not paved? So I you know, find out how much it costs.
We can look at the price, but it would be expensive right now.
Your comments are well taken.
But I can't say I didn't pass it on.
That's right. Some get awards.
Okay, any other commission?
It's been a while. We haven't had any updates on the bridge.
I don't know what it is that you might.
How about the ferry?
The ferry's been doing good. It'll be gone. Yeah. Yeah, they've been manning it. The ferry's been open more than normal, but I didn't know if we had. Every once in a while, they send us something, update on the bridge.
No, we'll get an update. Marine Bridge, we'll get you an update.
What about the loud mufflers coming through town?
No.
I didn't give enough on that.
Consider in the closed session for CCG 443-3.
Second.
Privilege and NCG 143-11. A6 personnel.
It's a brief.
We're going to wait.
Make a motion to have a brief.
All in favor, say aye. Aye. It'll take about 3 minutes.
This conference will now be recorded.
We didn't do it again, Rob?
You do it again, no? That got to be recorded, right?
All in favor, say aye. Aye. I need to go back to 4A and get a motion and approval to enact the state of emergency.
Motion. Second.
Any discussion? We added it to the agenda, but I forgot Got to vote on it.
Darn, well, we just adjourned the meeting.
No, we didn't. We got
Oh, closed session, okay. Y'all have killed me, bud. All right, all in favor, wait.
Can we say a word of prayer?
One blessing, my friend.
Okay, all in favor of adding the proclamation? Aye.
Aye.
Opposed? Motion to adjourn.
Second.
Motion to adjourn. Second. All in favor, say aye.
Aye.